Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Catherine Cummings, former clinician turned healthcare technology advocate. And today I have the privilege of welcoming Clair Laufketter, a clinician and dedicated health innovator, to the podcast. Claire's career began at the front lines of patient care, where she served as a travel nurse during the pandemic, gaining invaluable firsthand experience in high-pressure healthcare environments. Driven by her passion to make a difference, she has since transitioned into the role of nurse founder, where she leads an innovative company, aspirations, focused on transforming healthcare delivery. With her unique blend of clinical expertise and visionary leadership, Claire brings a powerful perspective on the challenges and opportunities in healthcare technology today. Thank you so much for joining us on the podcast, and welcome, Claire.
Thanks for having me, Catherine.
Claire, you have a background actually really similar to mine. You started your career as a nurse and have since pivoted to work in healthcare technology. I'd love for you to share a little bit with our listeners about your background and really what inspired you to pursue the pivot in your career over to the technology side.
Yeah, so I started off actually in the ICU at UPMC Children's, and only on my third day there, I noticed that there was a pain point in the flow of nursing in the ICUs, walking into supply room, not being able to find your supply. And I thought, there could be an app for this. So after finding that pain point, feeling that excitement on, I actually can have an impact on transforming nursing care and the lives of nurses and making our jobs easier. I just kind of had that thought. And that same night, I remember telling my mom, we were talking on the phone and just talking to her, and I was like, hey, I have this really good idea. What do you think? And she's like, this is awesome. I think we should totally, let's do it. My sister, she works in startups in France. And we all three got on the phone and just started brainstorming, and just feeling that excitement led me to where I am now in health tech.
How long did it take you to develop the application, and how did that process work?
So we're not developers, we're not coders. So we thought, well, this is a problem. What do we do? We looked up, Google. Actually, in healthcare, it's your worst enemy, but in business, it can be a helpful tool. So we looked up, how do we get a developer? We found a great development team out of South Carolina. So yeah, it took about a year. We worked closely with the development team. We would meet once a week. And throughout that process, actually, I was still working as a nurse, which was really helpful since I was the user. And while we were working with the team, I would come to the meetings and say, hey, we need this tool, a quick list, because I'm noticing as an ICU nurse, we're writing on gauze pads, this item, this item, this item that we need to restock our carts in the room. And we would take that list to the supply room and then have to find each one. So we thought, okay, we can add this feature in. Got to make it really, really simple, only a few clicks, because a nurse is not going to shift through and click a bunch of buttons in a software. They don't have time for that. So the least amount of buttons clicked, that's what we need. Another thing that we found was that nurses are having to call down to the supply team when something's out of stock. So we added in a low stock, out of stock communication button. So yeah, just being able to work and develop the app at the same time was really helpful. It was a little stressful, but very helpful.
I think all great startups have a piece of the innovation process in, you being in the trenches, right? And understanding how the process really works. And I see a lot in healthcare, the startup side. There's more and more nurses, more and more clinicians, doctors, people working in allied health that are making the transition over to the technology side because they see a problem that they think that they have a solution for. So, kind of along those lines, I know that there's a lot of unmet needs in healthcare that you're trying to address. I'd love for you to just give us a full explanation over what Ask Iris, your solution is, your software is, That way we have a really good picture of it. You've mentioned a couple of things, the supply room, trying to find things, but elevator pitch, what is the solution trying to solve for? What are you really trying to do to make the clinical staff's lives easier here?
Yeah. So really what Ask Iris is, it's a digital supply room directory. Um, it's simple as that. The nurse now, before Ask Iris, would have to go into the supply room with over 400 items in 400 bins and have to guess and search and pick through and see what supply they need. And now with Ask Iris, they type in the item that is needed and it will direct them to the exact shelf and bin. So very simple. It also can be used as a communication tool when something's low or out of stock with the supply team versus having to call down and make that phone call.
I love it. And as a former nurse myself, I can speak to some of the challenges that we often face in the supply room, especially when there's low stock and things didn't get reported. You're really in need of something crucially, right, in the ICU, and you don't have it. So you're trying to figure out where it is. And it kind of becomes a really big burden on the nursing staff. And I think speaking of burden, provider burnout is a pressing issue. All allied health fields are really suffering from provider burnout. How do you feel Ask Iris helps alleviate some of those day-to-day burdens that contribute to the issue of provider burnout?
Yeah, really just decreasing another frustrating point in your day, like just any little decrease we can get as a nurse really helps. So versus walking in the supply room and feeling overwhelmed or that burden of even walking to the supply room, like, I don't know if I'm going to be able to find this or how long is this going to take for me to find this? And now being able to walk in and just knowing that, okay, if I type it in, it's going to be right there. It's those little burdens add up during your day, and this takes one of them away.
I like the idea that you guys are saving time for people too, and allowing people to focus on what's arguably the most important part of your job is caring for the patient. So it's really cool that you're trying to refocus some of that time that you would spend looking for things to do your job instead actually being able to do your job. I know that you have some real world success stories for Ask Iris. I would love to hear some of the areas where you've piloted your program or your software and how, the feedback that you've received from healthcare providers on how it's helped them reduce stress or improve efficiency, things like that.
Yeah. So we started at the hospital I was actually working at in St. Louis. I just went because I don't know if anyone knows this, but it's really hard to do business with hospitals. There's a lot of roadblocks. So we started off with the hospital that I was currently in. We talked to the CNO there, and we were able to get Ask Iris into one of the supply rooms to beta test. And that was really useful because it's local. We can be right there in and out, getting feedback in person, setting up the supply room in person. And which feedback is really important, especially for a beta, because, we had to pivot a couple times. We found in the beginning, nurses called items different things. So if one nurse is calling a Foley catheter, or a Foley, and one is calling it just a catheter, it's essential that we had these back search tags into the software, which before we didn't. Before you had to type in the exact word, the same one, and expect to find the same thing. So that's something that we learned from the beta test. And as far as success, we are seeing that it's decreasing the time spent in the supply room. Before, it's about an average of 30 minutes a shift. With Ask Iris, we cut it down now to 5 minutes a shift.
Amazing.
Yeah. Not only that, that's increasing the patient satisfaction. So actually, I remember in our first meeting with ELO, you brought up that this could potentially increase HCAP scores, the patient feedback, which hospitals love to see that. So now we incorporated that into our findings as well.
I love that you incorporated that. So for all of our listeners that don't know what HCAP scores, it's a question set of about 27 questions where they interview patients after they leave the hospital, and they're asking them questions about, what their experience was like, how they feel like they received care. And those HCAP scores directly impact scores the hospitals receive and reimbursement for them. So it's really important that hospitals have solid HCAP scores. And the fact that you're utilizing that as part of your talk track now, I think is really impactful, especially to hospitals when they're trying to make decisions about implementing new technology and understanding what their ROI could potentially be.
Yeah.
So we talked about feedback and kind of how that's played into the role of the developing the application, especially in beta testing. How do you process regular insights from your end user, especially nurses or doctors, if they have any additional feedback outside of beta testing or any ideas that come up to make the application better?
So we have a direct point of contact with us and the hospital. We check in with them. Initially, when we were first setting up doing the full beta, we were checking in once a week. And now we've kind of tinkled it down to just once a month. But using those check-ins and that direct contact and full transparency really helps with getting that feedback.
Awesome. I'd like to pivot a little bit to you personally. I'd love to hear more about some of the challenges that you face transitioning from clinical practice to leading a healthcare technology startup. I mean, I know for me, the transition was interesting, right? Working directly with patients to working on the technology side, but I'd love to hear a little bit more about your transition.
Yeah, it was kind of rough in the beginning because I had none of the vocabulary to talk business with some of these big companies. Luckily, my sister, she has experience in startups and tech. So that's definitely why we chose to bring her in. She would have like little sit down meetings with us and be like, okay, this means this. This is, this is how we're going to do things. And this is how we normally do things in tech. And, it's pretty funny, actually. I'm still learning a lot, still missing some of that necessary vocabulary or any of those acronyms, but I think I'll get there.
Do you ever find yourself missing bedside care?
So in a way, yes, I do miss the rewarding aspect of nursing, that direct human interaction. But in a way, I still feel like with this software company that we're making an impact still on people's lives, nurses' lives, making their lives easier. So I keep telling myself that when sometimes I have those thoughts.
What advice would you give to other nurses or healthcare providers who want to become a founder or want to really dive into startup life, but feel intimidated by the tech startup world?
I would say if you have an idea and you really believe in it, do not be afraid of any roadblocks. There's going to be a lot of roadblocks at the beginning. But I would initially even start at your hospital, see if they have any programs that, like pilot programs, get the validation, like talk to other users at the hospital, like nurses, would you use this? Do you feel like this would make your life easier? What do you think about this? And then take that. And like I said, Google's your friend. It does help. Use resources, podcasts, start to kind of get into the tech world. There's a lot of resources out there now that are free online. Yeah.
I specifically just went to the health conference. I'm not sure if you've been before, but they have an entire section for nurse innovators. And there's a lot of nurse-led startups that are showcasing there. So
Cool.
it's a really cool area where I think a lot of clinicians, like I was saying earlier, are starting to say, there's these issues that are happening and they're not being addressed. And I feel like I have a solution for them. And luckily, there's a growing community of people like you who have said the same thing. And they're kind of rallying together to help with resources.
Very cool. Yeah, you're starting to see it more often.
Yeah, I like seeing it. It's like we're the ones that have actually been in the trenches seeing these things, right? We're the ones that probably have a better understanding of what is needed, right?
Yep, exactly. That's where the pain point, or that's where the best technology comes from, is from the users. So another resource that I recently found for nurse innovators is American Nurses Foundation. They have a grant that they run, I believe, once a year. It just started last year for nurse innovators. So you're starting to see these programs, like nationwide nursing foundations recognize that nurses are the ones that are in the direct patient care that really see what can be improved in hospitals. And it's cool to see that they're recognizing that.
It is very cool. Thank you for sharing that.
Mhm.
So what's next for Ask Iris? Are there any new features or partnerships or expansions on the horizon?
Yeah, we see so many different avenues, integrations with other inventory management systems, to as far as even taking it globally. One of our distributor partners, they're global, and they're even saying it's almost easier to get into hospitals in Europe. So focusing on one thing at a time, but we're excited for future things.
Well, final question, and it kind of is along the same lines as the last question, but what's your vision for the impact of Ask Iris? If you could envision something for the next 5 to 10 years, what would that be?
So we see ourselves in most hospitals across the United States, even globally, especially with our partnerships with Blue Star. I know ELO also is in Europe as well. So has seen us there. We've also been told many times that we could be in other industries, manufacturing, for instance, and Blue Star is involved there. So there's a lot of a bright future for Ask Iris.
It's very exciting. Well, thank you, Claire, for sharing your time with us today. It's been a pleasure having you on the podcast. Thank you so much.
Thank you so much for having me, Catherine. It's been great.
Thank you to all of our listeners for joining us on the podcast today. We appreciate your support. To hear from more healthcare voices like Clair Laufketter, hit the subscribe button and share this podcast with your friends and family. I'm your host, Catherine Cummings, and you just listened to Healthcare Voices.